Recording started.
Yay!
We made it. Only 9 minutes late, and we're recording instead of going live. But you know what? We are two very intelligent women, and we can make it happen. So, I'm Melissa Kobermeyer. You've seen me before. I am the inventor of NeverNude Coveralls, and we talk about going to the bathroom all the time now on the internet. This is my friend and colleague Lisa, and she has special qualifications to talk about this. I just have field experience. Lisa has education. So we're going to hear Lisa's background, and we're going to talk about going to the bathroom. So, Lisa, thank you for joining us today.
Thank you so much for having me, Melissa. It's really, I have a big passion and love for what I do. First of all, I love helping my clients, and so I am a pelvic health physiotherapist. I work here at Pine Integrated Health in Edmonton. Do we say Canada?
I mean, Alberta. If you're joining us internationally, we're in Canada.
That's good. So basically, what I do in my day is I help clients with like bladder health, bowel health, sexual health, pelvic floor and core sort of issues in those fields. And so, yes, I have a very sort of, I'm in a very awesome position to kind of help people all day, every day with these issues. And I see men and women for any of those conditions or issues around those areas. And ages range from like 18 to 80 years old.
Oh, wow.
So, and women and men, I see them all for pelvic health related issues.
Well, everybody's got to go to the bathroom.
Everyone has got to go to the bathroom.
Everybody hopefully has some kind of pelvic structure, and you are someone who can help them with that.
So anyway, do you want to know what I did to get into this position?
100%. Yes. How did you get to where you are? Yeah.
So I have a BSc physiotherapy degree from South Africa, actually. And then I came to Canada in 2015. I did additional courses to be able to practice pelvic health physiotherapy within my scope of physiotherapy practice. So that's the stuff I had to do to get where I am. It is kind of a little bit different than your normal physiotherapy that we all have probably had experience with. So it is a bit different, I must say. But so this is where I'm at. This is what I did.
And you're out of Pine Integrated Health Center. Yes. So let's talk about Pine a little bit.
Pine is a multidisciplinary clinic. We help families and women. That's kind of the biggest population of people that we see, but we also treat men. So we have chiros, we have massage, we have physio, we have psychology, we have acupuncture, we have breastfeeding consultants, we have dietitians, we have SLPs, we deal with kids and babies and children, and then mostly women, but also we see men.
Yes.
But hopefully I did mention all of our people.
Yes, excellent.
Someone listening to this that's from Pine would be like, hey, Lisa, wait, mention us. So I hope I didn't miss anything, but essentially we do a lot of women's health and sort of children's physiotherapy, children's healthcare, but we also do see men. So that's where I work.
Anybody could come to Pine.
Everybody
and see
can
Lisa.
come to Pine and see Lisa or any of
us. Excellent.
It's a really wonderful clinic. I can't even tell you how many clients come through our doors every day. It's a very big clinic. Everyone works together. And it's just a lovely environment to walk into and get help and care that we need.
Excellent. Oh, that's so wonderful. Okay, let's talk about going to the bathroom.
All right.
So tell us the details. Why is it important to listen to your body when you need to go?
Why don't we go?
That's a good question.
It's like, because honestly, if we don't go, and we kind of have to go, why would we kind of not go? I mean, it doesn't feel that great, does it?
No.
It doesn't feel good to kind of not go if we kind of want it or need to go. You know what I mean?
Yes, exactly.
So the bladder and the bowel specifically, I'm going to talk about that because that's kind of where waste gets to be expelled from the body. It is supposed to leave the body.
Yes.
It's not supposed to stay there. And so that is why I think it gets really, that's why it gets really uncomfortable and doesn't feel good to kind of keep it in and keep it in and keep it in.
Yes, exactly.
So I think that it's just simply sometimes not convenient to go.
Exactly.
And
Yes.
I think that it's just in our busy lives as moms, as dads, as in our work environments,
Mhm.
we are very busy, and
Yes.
we sometimes don't have accessibility, we
Mhm.
don't have time, we don't have the resources or whatever it is to necessarily go when we need to go.
Yes.
And so there are actually not so great things that can happen if we kind of not go when we need to go, and we keep doing that for like multiple months, years. And so yes, I can definitely talk about that.
Okay, so let's say,
Yes.
is there a split between men and women? What, like, or are the
No.
effects kind of the same?
Men and women,
Yeah.
both have bladders and bowels. That is the short answer here. So basically, the bladder and the bowel functions the same. As I'm going on through my little talk, I would maybe mention some differences, but in terms of having a bladder that has to expand to hold urine, to a certain amount of stretch, that signals get sent to the brain to tell the brain that, hey, well, we're getting filled up. You need to send a signal down so that this person, this body,
Yes.
can feel that it needs to go.
Yes.
So at that amount of stretch, because we are allowing the bladder to stretch out,
Yes.
it has capacity to contract to get pee out.
Yes.
Okay. And this happens typically at 3 to 4 hours after our last pee or whatever. And it also depends on the amount of fluids that we have in that time. If we don't go, and we kind of suppress the urge for a long time, like we go 5 to 8 hours,
Yes.
instead of 3 to 4 hours, and we do that for a very long time, we might, well, the first thing is the bladder can start to change.
Oh.
Yes, the bladder can actually start to adapt to whatever it is, the habits and behaviors that we have.
Well, there you go.
I
We
know.
can change, okay,
Well,
in
I
a
know. So,
good way.
Sometimes not so great.
Okay.
I'm gonna say that initially, what can happen if we don't empty the bladder often enough is we could develop like bladder infections.
Yes. Okay.
Long term, I would say, but a lot of people don't. So a lot of people won't develop bladder infections, right?
Okay.
What happens over time to this bladder is it actually does affect the walls of the bladder. So the bladder is supposed to have this elastic wall that kind of expands and contracts. So if we kind of hold pee in for very, very long periods of times, and we do that for multiple months, years, the walls become thickened and rigid.
Okay.
So that affects the contractility of the bladder.
Okay.
So we can't get as much contractility. We can't get as much pee out.
Yes.
So that's why we can develop UTIs, which can be really unpleasant. Have you ever had a UTI?
Unfortunately, yes. I mean, I'm just at this age, as a woman, I'm pretty sure most people have experienced that. But
yeah, so you need to go to your doctor. You need to get antibiotics.
Yeah.
It is very painful and sore. Not ideal, I would say. So that could be kind of what happens. But then there are other things that can happen too. We might not even feel anything. But over time,
yes,
what can happen, because the bladder walls get so rigid, is we can get one of three things can happen, or all three can happen, or one can happen. But basically, the bladder can become overactive.
Okay.
What that means is, and I see this in practice all the time with working with my clients that have bladder issues, is the bladder actually contracts quite a lot in the day because it signals to the brain that it's kind of a little full still.
Yeah.
So then it contracts all the time, and then you would feel a lot of urgency, frequency, right?
Yes.
You need to go all the time. Whereas in the past, you were able to hold your bladder for 8 hours.
Exactly. Yeah.
Yeah.
Okay.
All of a sudden, you have constant urge. Sometimes the urge is so unpleasant and so uncontrollable that you would maybe even lose urine.
Wow.
Like urgent continence, that's urgent continence. So basically, you can't make it to the washroom in time. There is leakage of urine. So that's one thing. The second thing is you could get an underactive bladder. Because of the stretch of that sort of bladder, it does actually, sometimes it kind of like fills up and fills up and fills up, and it doesn't actually tell you that it's full.
Because you've been ignoring it.
Yeah.
Yeah.
So it
Okay.
fills up and it fills up to a point where it kind of starts leaking out.
Oh, wow.
Without you even knowing that it was full.
Yeah.
Yeah, so the
Wow.
signals the signals can become a little bit less pronounced. I mean, we think that we're fine, but then we're leaking.
Yes.
So that is another that's overflowing continence. The bladder gets overfilled. So basically, the urethra is where the pee comes out, gets pushed open, and things just leak out.
Oh my.
Yeah. Anyway, so there are not so great things. The third thing is prolapse. Now, men don't really. It's fairly uncommon for men to develop bladder prolapse.
Yeah.
But you can imagine that if you can't empty your bladder, or you're trying to empty more because you have to pee all the time, so you're not emptying. So now you're pushing.
Yes.
Now you're straining to pee.
Yes.
So that actually creates a sort of a descent of the actual bladder. So the bladder can actually sink down, and then it's in a not so great spot. From there, it can sort of add to the problem of not being able to empty. It can kind of be in a position where you might feel it all the time, right? Like it's not tucked in there, but it's kind of like a little bit out.
Yeah.
So prolapse is one thing that's not great.
Yeah.
Men, I would say, have more issues around hernias as well as rectal prolapse. So you can imagine over time of trying to empty your bladder by pushing all the time to get pee out, how that can affect just general pressure in other organs.
Wow.
So your rectum can start to prolapse in guys.
That sounds
not
wonderful.
I'm sorry for all the graphic information.
No, it's completely fine. Exact. But okay, is this permanent? Like,
oh, and sorry, just one more point on that.
Yeah.
Hernias.
Yes.
We have hernias. More hernias, and women can also develop hernias.
Yeah.
I wonder if you know what a hernia is, but well, I even wonder if they know what a prolapse is. But anyway, so basically, a hernia is kind of a sort of a weak area in your abdominal wall or your pelvis where something can kind of protrude out.
Yeah.
Which can be very painful and does need surgery over time potentially. So anyway, straining to empty an organ is not ideal.
Yes.
And I feel like it can happen over time if we don't have good habits.
And is this like long term? Are we saying like 30 years? Or is this
something
that can happen in 5 years? If you're constantly ignoring that urge to go to the bathroom. I know I have a sister who's a nurse, and she's like, well, we have patients sometimes we just can't go. And so it could be shifts in a row that she's just not going to the bathroom when she needs to.
And it typically happens with my shift workers.
Yes. Okay.
Yeah, it's very common. It's the busy, you don't have bathroom breaks. You're busy with clients, you're busy with patients, you're busy on a job here, right? So those are the people that, like, it will not affect them for years and years and years. But then I'll have my 65-year-old male client that comes to me with like urgency, frequency, bladder leakage. And I mean, those things can be sort of influenced by other things in the pelvis as well. But yes, I do see that often. That's the case. It can happen. It can happen sooner, or it can happen later. It's hard to say. I don't know.
Yeah.
If there's how many years, or I think it is different for everyone. Yeah.
Oh wow. And okay, so
do you want me to mention something about the bowel?
Might as well. I mean, I do NeverNude Coveralls. They uncover everything, so you can go to the bathroom.
Do you want to say your thing first before I talk about the bowel?
Well, I mean, my thing is, I remember being in the field and not wanting to go to the bathroom. I was in positions where there wasn't a bathroom available. So you're looking at the forest, you're looking at the crew of people that you're guiding or working with, and you're saying, do I have to go do this? Because with coveralls, you had to strip down naked, basically. And I mean, there were some times when we had people patrolling with rifles because there were bears around, and you're like, and I need to go into the forest. Excellent. So we would do other things too. Like we wouldn't drink water or any fluids at all to like minimize the having to go. I mean, I don't know if there was a bathroom not available. I don't think in 10 years of field work I ever pooped in the woods. Like that's horrible. I don't want to talk about this on the internet, but because I didn't want to.
Exactly.
So because you don't feel safe, you don't feel dignified, there's all these external issues, and that's where these coveralls came from. At least you can stay clothed. for the most
Exactly.
part. Like it's very, very disconcerting to strip in the woods.
Yeah,
Um,
that's true.
so I mean, I don't know if you can speak to those long-term implications too of just chronically dehydrated because you're
Yes.
like
Yes.
I'm assuming that
Yeah.
also would affect these
Yeah,
systems, right?
exactly, for
So
sure. And I think that maybe one of the big things is the bowel can be affected by that, for sure.
okay.
Like if you don't drink enough water and you don't poop for like a long time,
Yes.
right? Like what happens is the bowel actually like takes out the nutrients from the food that we eat
Yeah.
and takes out the water from the
Yeah.
food that we eat, and the waste gets pushed through the colon. First we have the small bowel, then into the large bowel. If it stays there for a long period of time
Yes.
and it's already not that hydrated,
Yes.
it kind of like gets harder and harder. And
Yeah.
then we really have to strain more to get it
Yes.
out, which we're looking at like the unpleasantness of straining. I mean, a lot
Mhm.
of us have strained in our lives and it's really not fun. You
Yeah.
can, it's like fissures,
Yes.
hemorrhoids, bleeding. Why would you want to poop?
No,
You know what I mean?
exactly.
So,
Yeah.
yeah, if it stays there, if especially in the rectum, which is kind of the last part of the bowel,
Where you get the urge to go and you're like,
yes,
but I don't want
but
to.
I don't want to. I will
Yeah.
go later when I get home,
Yes.
right? So if it stays there, it sometimes has to get sucked back into the
Wow.
colon,
Yes.
like sucked back up, and then more water gets taken out of it. And then it's kind of even more harder when it
Yes.
comes down back into the rectum.
Yes.
And what we've seen over time is that it can actually affect the bowel itself as well. Like it does actually, the bowel function is a very intricate process. It's a very complex process between the brain, the muscles of the organs, as well as nerves. And
Yeah.
if we ignore urges, the same as the bladder, those areas, the nerves become desensitized. We don't feel urges anymore.
Yes.
So it kind of goes away.
Oh.
But we still should be going. But
yes,
we feel like we have to go.
exactly. Okay.
And so bowel impaction is a very serious condition that can act when you just can't get it out.
yeah.
That's very bad.
And are these all reversible?
You might have to get surgery
like,
when you have that.
It's surgery.
Yes.
You get to a point. So
I know. It's
listen
not
to your
good.
body. Go to the bathroom. Okay. Excellent.
One other
Wow.
thing I want to mention that's kind of like sort of a very interesting topic out there is the microbiome or the
Okay.
gut biome.
Mm-hmm.
The gut biome lies in our gut biome is sort of different for everyone, and everyone has a unique gut biome, but it lies within the walls of the bowel. And so if we don't get rid of waste well,
Yes.
it can actually affect our micro gut biome,
Wow.
which
Okay.
affects our endocrine system, which is hormones.
Yes.
It affects our digestive system, how we get rid of stuff.
Yes.
It affects our immune system, how we handle inflammation, or how we get rid of inflammation, or how we tolerate inflammation.
Yes.
It can also affect our nervous system.
Yes.
How we feel about our bodies, what we think about our bodies. So it literally affects the whole body.
Yes. Well,
right? So it's
that's,
like,
I mean, it
actually,
makes sense.
it's like the microbiome is like a garden.
Yes.
If the garden is happy, there's no weeds, the soil's healthy, we're thriving as humans.
Yeah.
But if it's not happy, it affects every single thing. It affects our whole ecosystem.
And you know what? It makes
Hormones,
sense. It makes so much
immune
sense.
system,
Oh my goodness.
nervous system,
Yeah.
all of those things, right? So it is a really complex sort of problem.
Yeah.
Honestly.
Well,
Yeah,
I mean,
if we don't expel when we need to.
because the body is done with those things. It needs it out.
Yeah,
And
that's
it
why we have
is
those
trying
organs.
to tell you. And so you're supposed to listen.
Exactly.
Oh my goodness. Okay.
Yeah.
Well, I mean, what symptoms would you say if we're giving a general talk? We have people who are field workers, we have people who are shift workers who are listening. Are there symptoms you would say that are concerning, that are go talk to someone? Go talk to your doctor, go talk to your
healthcare provider.
Yeah.
Go
come to Lisa.
Support,
yeah, like okay.
Go see a pelvic health physio.
What kind of symptoms are we looking at?
Yes. Okay, so these are the things. People come to see me for prolapse. So prolapse is when your organ has kind of come down, and a lot of people feel it.
Okay, can you see it?
You can see it sometimes.
Okay.
Yes, so you can see it either vaginally or you could feel it vaginally, like with your finger, or you
Yeah.
could see it rectally, or you could feel it rectally.
So,
So
okay.
if something is bulging out, it's not ideal, it's not normal, it does affect the actual function of that organ, and
Yeah.
it is something that a pelvic health can help you with.
Mhm.
So I'm going to say that there are things that we could do, but most often when we listen to our clients' stories, it comes back to like, what did you do how have you been doing things?
Yes.
And what have you been doing in the past? So it's never just like, oh, it just happens, right?
Yeah.
There's always a sort of a reason why things like this start to happen. And we a lot of times can track it back to not like actually listening to certain bodily cues, not actually responding well, not knowing what's wrong and what's right.
Yes. And I mean, we all get to the point
Yes.
where we gain a few pounds as we get older. We
Yes.
sit more in an office chair, and we're like,
Exactly.
maybe this is just what my body is
Yeah.
doing as I get older.
I
Like,
had a client today
yeah.
that told me that she never knew that she wasn't supposed to strain
Oh,
when she had a bowel movement or when she had to pee.
well, there you go.
Exactly. So that's another thing. If you see that you are straining a lot to get pee out, you're straining to get poop out, that is another reason to potentially check in.
Yeah.
To see if there's anything that we could do to get to the root cause of it, to optimize those sort of areas of your body to work better and to come up with a plan. Right?
Because again, the longer you leave it, the more
Exactly.
serious the health implications
Exactly.
get. Does this even go to the point where it could contribute long-term to cancers or anything like that? Are there any studies like that?
I don't have any concrete knowledge on that.
Yeah.
I know that over time with kind of the microbiome and all of those things that get affected, that you can get inflammatory diseases and things like that from not looking after your bowel health. Or, I mean, there are other predisposing factors as well. It's not just our habits and our behaviors that make things happen, but but I don't know about cancers.
Yeah.
I'm not sure. So
yeah, I mean,
okay. And I'm not a physician. I'm a resident physio. Anyway, so but what I want to say is that these things are not. It's not normal to strain. We shouldn't be straining. We shouldn't be feeling weird like sensations of pressure and heaviness around the vaginal as well as the rectal area.
Yeah.
Even like stuff like pain, like you have bladder pain, like urgency, frequency. Even stuff like just like abdominal pain. Those things are things that we could potentially kind of address and figure out, why is this happening? Oh, okay, your bowel is not emptying well. Why is your bowel not emptying well? Okay, because of XYZ. Or you're not drinking enough water. Why aren't you drinking enough water? Okay, because you have a very hectic shift at work. How can we help support you to be able to bring in those strategies and tools to be better?
Okay, so then let's talk about good bathroom health.
Yeah.
So what does that mean? You said every 3 to 4 hours ish is And what about bowel health?
Bowel health is considered constipation.
Yes.
If you're not pooping for 3 days, and your poop is hard, lumpy, and dry.
Okay.
That is the definition of constipation. So if you are pooping 3 times a day to 3 times a week, that is within the normal.
It's a big range.
It's such a big range. Everyone's different.
Yes. Okay.
So it's an issue if you're kind of not pooping. If you're pooping less than 3 times a week, that is a problem.
Okay.
Yes. And your poop is hard, lumpy, and dry.
Do you want to show your picture?
I can show my pic. Oh, you wanted me to show that? Oh, yes. Okay, this is very graphic and visual, but it's not that bad.
It's not that bad.
Guys, if you have to. I'm joking. This is the Bristol. Oh, I have to. Do I keep it like this? Yeah, that's good.
There, yeah.
The Bristol stool chart. It gives us a chart of different types of poops, and you can kind of see the top starts with very dry, lumpy, hard poops, and then it goes down, and then at the very bottom it's diarrhea, like liquid.
Yes.
So basically, if you're at the type 4 or 3 or 4, which is kind of like, if you want to count from the bottom, number 3 or number 4.
I can point. Yes, yeah.
Yeah, those would be considered okay. The 1 and 2, not so great.
Yes.
And then
up there,
the 6 and 7s are very liquidy, and so
and unfortunate. If you're on site in coveralls and that's your issues, you're not having a good time.
So yeah, if you are, I mean, that's a thing, right? We just don't know about this stuff. We
Yes.
don't know whether we're having normal bowel movements. We don't know how we're supposed to have bowel movements. So it's really important to talk about this stuff. And
Yes.
we don't talk about it because it's such a
No, I
hidden
mean,
part of the body, and it's like
it's
embarrassing. But honestly, like we have to actually spread the word that it is important for our health to have proper healthy bowel movements, proper bladder function. Yes.
and health and safety is such a big thing on site
Yeah.
that we talk about. We talk about being safe around equipment we're using, and we talk about what happens if people get injured. But
What about this
these-
part?
Exactly. We are going to the bathroom every day, or we should be. Like, you
I
need to be
know.
going and visiting a toilet. So it's something I feel very strongly about that should be included on our safety sheets. And as of this point in time, the safety sheets I've dealt with, I've never seen where you go to the bathroom safely, and that's kind
Well,
of key.
if you think about it, like prolapse affects like a lot of us.
Really?
Yeah.
Why?
I think 50% of women that's had babies
Yeah.
will, or 50%, I think it is 50% of women in general will have symptomatic prolapse
Excellent.
at some point.
Yeah.
And leakage of urine. How unpleasant is leakage of urine?
Exactly.
It affects us on every level of our lives.
Well, and it's a dignity thing too. No one
Yes.
likes the idea of not being
No.
able to. It's literally something
Yeah,
that
exactly.
we make the leap from toddlers to children. We're like, now you can go to the bathroom by yourself.
Exactly, I know.
Now you can stay
So
dry.
now it affects your relationships. It affects your self-confidence.
Mhm.
It affects your socioeconomically. It affects you because now you have to support yourself.
Yeah.
With like other things. It is just not great.
Yeah.
And then if you look at the urinary tract infections, right? You're off
Yes.
of work.
Yep.
You're off of work for how many days? You
Well-
can't come back to your shift work.
And you don't want to explain that to employers usually too, because it's embarrassing
Yeah.
to talk about these issues.
Yeah.
And even if it's something chronic that comes from your habits at work,
Mhm.
it's still, I mean,
It should be addressed.
yeah.
It should be addressed. And when I see my clients for an assessment, we figure out. We don't just like treat whatever is presenting. There's always a reason why things present.
Mhm.
And it's important to sort of track and assess to see where did this start? What could potentially be causing this, right?
Yes.
And a lot of times it's our behaviors
Yeah.
and our habits.
Excellent. So it's up to us.
It's up to us.
I mean, no one else is looking out for your bathroom urges. You are literally the only person who feels them. So,
Exactly. And you have one body.
yes. Oh, that's so true.
But okay, just a little bit of hope here.
Yes. Okay. Thank you. Yes.
Doom
Let's
and
do
gloom
that.
all the way.
Yeah.
That some of these things are manageable. Some of them it is reversible.
Okay.
And there are certain things that we could do to really support people that have these issues.
Yes.
So don't think that because you're already there, it's already done. We can't do anything about that. Like
Yeah.
there typically are things that we could do to support people to get to why this happened in the first place, what we can do to kind of support ourselves better going
Mhm.
forward. There's always a reason why things are happening in our bodies,
Yes.
and we only have one body.
Yes. So let's
we
take
have
care
to
of it.
support it. Yeah, I know. Never mind
awesome.
supporting the other people around us. If we
Well,
can't
there's
support
that too.
ourselves-
Yeah, exactly.
Yeah.
Well, we have reached our time. So, Lisa, thank you so much for coming on to
you're
our
welcome.
show. I mean, technical
Aw.
difficulties aside, this is now posted. By the time you are seeing this, this is posted. And we'll put links for Lisa and Pine and coveralls and everything down below. But thank you for watching, and thank you for
Thank you for having
talking.
me,
And
guys.
this is so wonderful.
Yeah, and if anyone has any questions or any comments or concerns, like I might get you to put my email address up there, or
Oh,
just
yeah.
a link to Pine. You can also
Yeah.
just email Pine Integrated Health and reach out if there's anything you want to add or any questions.
Oh, yeah. Take care of yourself. Get connected. Lisa is here and she is amazing. Thank you so much.
Thanks, guys. Bye.